Hi folks, so we're just getting started here, just going to wait a little bit for folks to get on the stream. I'll wait a little bit for I tried to use the schedule a live video post with on Facebook's desktop version, and when the time came for the scheduled post, it wasn't letting me go live, so I think that feature is still under construction. So I'd like everybody to share and invite folks to this live stream link, and we'll just get started in just a few moments. So just reminding the folks who have just joined, if you could please take a moment to share and invite folks to watch this live stream link. There were some issues with the scheduled live stream post that I tried to do with Facebook, but this link's working now, and we'll get started in just a moment. Go to Freedom Road, Chicago. All right, so we're going to get started. So my name's Andy. I'm a member of Freedom Road Socialist Organization here in Chicago. I'm also professionally a family nurse practitioner at a community health center. And I have actually been treating folks who have or are suspected to have the coronavirus infection. What we're seeing now with the COVID-19 pandemic is, without a doubt, the greatest global crisis since World War II. The official numbers stand at around 650,000 confirmed cases worldwide, but with looking at the history of recent pandemics, the laboratory confirmed cases are only a tiny fraction of the actual current cases. We'll really only be able to know the full extent of the pandemic and all of that several years from now. With the SARS pandemic and other recent pandemics, at the time, like in the United States, only I think there were 1,000 deaths recorded from H1N1, the swine flu, but 2 years later that estimate was adjusted, based on epidemiological data, to expand to over 20,000 people dying in the United States. And so what we're seeing now and the data that we're getting from day to day is really only a fraction of the real effect of the pandemic. And just a few days ago, Freedom Road nationally attempted a live stream, also ran into some technical issues with the live streaming, but they did publish the prepared remarks, and I've included that link in the event page on our Facebook page, along with a number of articles analyzing the current crisis. So the idea for this video came from our National Study Sunday project, where every Sunday we post readings, books, articles on Marxism, aspects of history, and encourage people to read them and think critically about them. This Sunday we've decided that the most important focus is on this current crisis. So just a very brief discussion of the COVID-19 pandemic itself and the virus itself. It's a respiratory virus that passed from animal to human contagiousness. The first detected cases were in Hubei province in China, in Wuhan city. And within a couple weeks, they realized that this was a very virulent virus, meaning it can spread very easily. In about 80% of people that get it, it causes a relatively mild illness. And in about 20% of people that get it, it can be more severe, necessitating hospitalization. And the fatality rate from this infection ranges between 2 to 4%, higher for older folks and people who are immunocompromised. As with any kind of major crisis, the virus is a natural phenomenon. Humanity has known pandemics and plagues and things throughout our entire history, but the response that societies and governments are taking is very dependent on the social character of those societies. And what we've seen in this pandemic is that there's been a really stark contrast between the responses that socialist countries, including particularly China, but other socialist countries as well, have taken, and the responses that the major capitalist countries have taken. I'm particularly going to be looking at the US and UK, and also other countries of Europe. The response that China was able to effect was, after the first couple weeks, where local authorities in Wuhan were handling it, once the seriousness of the pandemic, of the infection was realized, the centralized government of China was able to effect a really decisive, unified response that was ultimately effective in completely controlling the pandemic. So this included not just the social distancing that we're seeing promoted in Western countries, but also, very importantly, aggressive testing, tracking of individual cases, and quarantining of individuals and families. Another particular hallmark of China's response was comprehensive social support. A lot of this was already in place. China has a socialized medical system and local disaster response systems in place. The entire resources of Chinese society were mobilized with the specific purpose of protecting human life and containing and controlling the spread of the the epidemic at that time. They were able to shift, using socialist central planning, were able to shift production priorities. They, famously constructed a hospital in less than 10 days in Wuhan. And also other, major factories, major production lines shifted from making things like cars to producing medical equipment. And what we've seen from this is China has, is no longer, completely left the exponential growth rate of the virus. There were a total of 8,600 cases in China, and there are now very few cases per day. It's effectively under control. The only other countries that have succeeded in controlling the spread are Singapore and South Korea, which followed a very similar model to China, and also importantly had the recent experience of the early 2000s SARS epidemic there that gave them a lot of experience in dealing with these kind of outbreaks. Vietnam has also responded very effectively. And this is a really big contrast to the US, UK, and Europe. So the really aggressive, coordinated, people-first response that China was able to effect basically bought the rest of the world 2 months. As soon as it was realized that it was severe, just before the start of 2020, I think December 29th, China alerted the US and other countries of the world that this was something to be taken very seriously. And without exception, and particularly in the US, that 2-month breathing space when we could have been aggressively preparing was completely squandered. So speaking particularly about the US and the UK, the top leadership downplayed the severity of the epidemic. Trump and Boris Johnson, who now Boris has coronavirus, they downplayed the severity. They declined to take preventative action around it. And the first national big response that the U.S. made was to offer $1.5 trillion to the big banks in short-term loans from the Federal Reserve. I think that's emblematic of where their priorities are. And, that's been extended. There's been a lot more, bailouts and things given to big corporations. The testing strategy in the U.S. has been very haphazard. Very critically, the U.S. declined the World Health Organization's offered tests. So the World Health Organization offered tests to countries. The U.S. declined those because a private corporation in the U.S. wanted to produce those for the U.S. And it turns out their tests did not work. And so the U.S. is now in a situation where the pandemic is rapidly spreading and there are not enough tests to test even all suspected cases, let alone be able to test family members and those exposed to people with COVID-19. The response that the U.S. And UK have adopted is what's termed mitigation. So they're promoting social distancing. Some businesses have been closed down. And the goal of this is just to delay the spread so that health systems and hospitals aren't overwhelmed all at once. In contrast, the Chinese approach, which has also been adopted in Singapore, South Korea, Vietnam, is what's termed suppression. So this includes not only social distancing, but aggressive testing and tracking and quarantining of infected individuals. And this has been the only approach that's been actually effective in stopping it. Looking at the kind of economic effects from the pandemic. So one of the biggest things that has led to the wavering, half-hearted, inconsistent response from the capitalist countries is anxiety and concern over the effects that this is going to have on the economy. We are entering into the biggest economic downturn since the Great Depression, and this is not only due to the pandemic. Lots of people aren't working, so obviously the economy is slowing down. But this is also a capitalist crisis of overproduction that that's been kind of due. The pandemic has been a trigger for the economic crisis. It's not the fundamental cause. In the U.S., we've seen the market forces that the capitalists love to praise and talk about. We've seen exactly what their role is here. So I've got a couple of different news stories, and these are just a kind of the tip of the iceberg. I think there's a lot more things like this, but I mean, it ranges from individuals stockpiling hand sanitizer and other cleaning supplies and masks, but it goes, on the much larger scale. There, is the example of the company that volunteered to produce the tests and then failed to do so. There was also a company that tried to start up and produce an emergency supply of ventilators, and that fell through. The story is on the New York Times. Let me see. Where is it? Yeah, in New York, their beloved market forces have driven up the cost of ventilators from $25,000 a piece to over $45,000 a piece. And in, I believe, Philadelphia, a major hospital that was purchased by a private individual and closed down in recent years, he's refusing to open that back up. They're in a legal battle, a legal struggle to force him to do so. But the capitalist legal structure and the priorities of capitalist society don't allow that. So overall, we're seeing that the capitalist system is just completely unprepared to respond to this in a way that defends and preserves human life. And at every step of the way, they've prioritized profits, boosting the stock market. And this is, signified in a big way by Trump and lots of capitalist talking heads talking about how important it is for everyone to get back to work as soon as possible. The lieutenant governor of Texas famously said that older folks would be willing to risk death in order to boost the economy. So we're really seeing in this crisis, it's bringing the contrast between the socialist and capitalist systems into very stark relief. Another, aspect of the pandemic, so I've mostly been talking about the national responses to the pandemic and the contrast between those. But another huge area of difference is in international relations and international solidarity. So China, Cuba have been more than exemplary in offering international solidarity. China has sent doctors all over the world, but particularly to the hardest hit areas like Italy. And Cuba has also sent doctors to Italy as well. Talking about Cuba, which has a long history of really heroic medical solidarity with the rest of the world, they've also developed the first effective treatment, the first effective medication for COVID, and this is the interferon alpha 2b. And now, I think the last I saw was 45 countries are requesting supplies of that medication. Cuba also allowed a cruise ship where some folks were experiencing symptoms of COVID. Cuba was the only country to allow that cruise ship to dock at their harbors. The U.S. was a request was made to the U.S. and it was declined. In terms of international solidarity as well, so Venezuela's national response has been really decisive and putting people first as well. They don't have a whole lot of cases, it's not very severe in Venezuela, but their response has been decisive as well. But Venezuela's requests for international aid are indicative of the differences between capitalist, imperialist foreign policy and socialist foreign policy. Venezuela requested a $5 billion loan from the IMF for vaccine support, not vaccine support, but pandemic support, and that was declined. Meanwhile, they've gotten medical aid and tests from China and Cuba. So another aspect of the crisis. So I've mostly been talking about the direct responses to the pandemic once it was already underway. But that's only a really small aspect of what determined how the pandemic has played out in various countries. The fundamental preparedness and fundamental orientation of societies from a capitalist or socialist standpoint lends them to be prepared or unprepared. So socialist countries where healthcare is a human right, where society is organized around people's needs, are much better prepared to deal with these things. Contrasting that with the United States, which has a for-profit healthcare system where many people's health insurance is tied to their employment. It's just a complete disaster when I think the recent figure was that 3 million people are out of a job and no longer have that health insurance at a time when they need it most. Also, there's been major oversights in the U.S.'s staffing and prioritization of organizations like the CDC. Like Trump has left hundreds of posts at the CDC unfilled, and this also shows where the orientation and where the priorities are. In Italy, which is along with Spain, one of the hardest hit countries in Europe. I believe Italy has recently over 11,000 deaths. The healthcare system is completely overwhelmed. And a lot of the responsibility for that lies directly with the EU mandated austerity that has forced Italy to, in recent years, over the past decade, to make big cuts to their social medicine system. So, austerity and the fundamental priorities of capitalist society are making the population even more vulnerable than they needed to be. So that's the main remarks that I had prepared. This talk was mainly about the differences in responses. I'd like to plug the recent live stream video on the Freedom Road YouTube page, which has more information about what a people's response to the pandemic could look like. Some of the fundamental things are, demands are following the model of suppression that China has followed, supporting people's, basic needs, like a moratorium on rent and mortgages, unemployment assistance. Like the United States even lags way behind other capitalist countries in terms of the assistance that people are being offered. They're giving billions and trillions of dollars to big corporations, while some Americans are going to be getting $1,200, a one-time payment of $1,200, which is going to be taxed. Whereas other capitalist countries are giving, I think England's like 80% of paid leave. So I'd like to open it up to questions or comments. Just looking through here, Steph posted a quote from the New York Times that New York has about a week of medical supplies left. And I think there's a lot of other good... someone mentioned that Trump, he was trying to maneuver with a German company to secure the production of vaccine, but he was only going to have it available to the United States. So I think just there's an endless list of criminal actions by the capitalist countries. Kobe is mentioning a measure that's proposed by the mayor of Chicago here. There's like over 3 million people in Chicago proper, let alone the larger metro area, which is around 10 million. And the proposal by the mayor has been that 2,000 people are going to get $1,000 for rent support by lottery. So like I think it comes out to like 0.07% of Chicagoans benefiting from this or potentially benefiting from this. But yeah, I'd like to open up the chat to anybody that has any specific questions about aspects of this. Like I said, I'm a member of Freedom Road Socialist Organization. I'm also a family nurse practitioner. So there are healthcare aspects and public health aspects of this that I have kind of specialized technical knowledge about. So if there's any questions regarding that. Just while we're waiting for questions, I can talk a little more about the demand. So yeah, people are asking, what kind of organizing and can people be doing? So I would definitely plug the Freedom Road video. There's a number of articles on Fight Back News that folks can check out that talk about people's demands. So from a big demand that's being pushed by the Chicago Alliance is releasing incarcerated people, because people who are in prisons right now, there's really no way to practice effective social distancing, and infections that come into the prisons and jails in the U.S. could turn into death camps very quickly. So that's one big demand, and organizing around promoting that demand. Another one is releasing people from the concentration camps for migrants at the borders. In a very similar way, these are people crammed in to very cramped conditions with very little access to the necessary protective equipment and healthcare that could prevent a rapid spread. So we've got some questions. So Bassem has posted a guide to demands for the immigrant rights movement. And we've got a question: how can we fight for universal face covering in public, PPE for all essential workers, despite public health officials dragging their heels on this? So yeah, this is a really big error that the public health response has made in the U.S. So in China and a lot of other countries in Asia, there's been widespread, almost universal wearing of masks in public. This has not been something that's been pushed or recommended in the United States, but when one of the top Chinese medical scientists working on pandemic response, in an interview he was asked, what's a big error that they're making in Europe and the United States? And he said, without a doubt, it's, everyone should be wearing masks at all times in public. They can't, prevent 100% transmission, but the biggest way that the virus is transmitted is through respiratory droplets. So through coughing, sneezing, and masks can really reduce this in a big way. So just a correction from Bassem, that link that he posted is resources, not demands. As far as how we can organize for universal face covering and getting the necessary personal protective equipment. So I think the strategies for organizing around this need to come from the workers themselves organizing together and demanding these things. Like we're with in this current climate where healthcare workers are more needed than ever, it strengthens our position to make demands on the establishment, because they can our labor is absolutely essential, and we need to workers should be leveraging this. There's a lot of good resources and articles on Fight Back about this struggle for protective equipment among UPS workers, and I know there's a lot of suggestions and organizing guidance around that, and I think that the analysis there can be broadened out to healthcare workers as well. So we have a question from Jess. Can you speak to the issues of racism and xenophobia in the context of this crisis? We've seen several instances of violence and harassment against Asian Americans. The virus originated in China, in Asia, but there have been epidemics and pandemics that originate from all parts of the world. This isn't a particularly Asian or Chinese virus, but the administration from Trump all the way down has persisted in using racist terminology, calling it the Chinese virus, and we need to really speak out against this. So in Chicago, we saw, in the early days of the spread of this, acts of harassment against Chinese folks, and kind of like the Chinatown district of Chicago was like completely abandoned. I think that we need to be very clear that what's needed is solidarity. I think one of the biggest concrete ways to fight this is to point out that it started in China and they've effectively combated it. The best thing that we could possibly do right now is learn from the experience to China's response to the pandemic. So we have another question: how can we support healthcare workers like you who are in the front lines? So I wouldn't say I'm in the front lines. I would say the nurses and physicians and techs and all the folks working in the major hospitals right now are really at the front lines. Some things that you can do are, practicing social distancing, wearing masks if you have them available in public, washing hands frequently. Another big, very helpful thing is before going to the emergency department or going to see your doctor, call them first, because they may be able to triage you if you're having some symptoms, and determine whether your symptoms are severe enough to be admitted to the hospital, or if they need to, or if you can be managed at home. This is a really important aspect of managing it concretely in this, in our current situation. Obviously, if we had enough tests, if our government was taking the right approach, the suppression approach, those recommendations would be very different. But in the current situation, going to the emergency department as soon as you have a cough is not a good idea for a couple of reasons. It could be that you don't need to go to the emergency department. It could be that you're, good to just recover at home, and a telephone call or video call to the emergency department or your doctor can help determine which way to go with that. Another thing is, while the pandemic is, obviously spreading and infecting a lot of people, there still are a lot of other conditions and viruses that can cause symptoms similar to COVID. So if you're having a cough and you don't have COVID, going to the emergency department is the most surefire way to expose yourself to people who have it. So those are just some kind of general recommendations about what individuals can do. Of course, as far as organizing, keep continuing to be connected with people. Your organizing communities, continue to organize and make these demands, within organizations and community groups. So I'm seeing a question in terms of mask: is a cloth mask like a t-shirt or bandana better than nothing? Absolutely. It's, completely criminal that the CDC, and the healthcare structure here is putting us in a position where masks are not available. But a bandana or cloth around the face is better than nothing, for sure. So just one moment. Okay, so we've got a message from Steph. So at my workplace, a university, as clerical workers, we've demanded and won full pay for all workers since our salaries are already allocated for the year, whether or not our jobs allow us to work from home. So that's great. I think there's opportunity for a lot of workplace and worker organizing in this time. So we've got a question. I've noticed commentary from some hospital workers heavily criticizing people for wearing masks in public, stating that these are masks that are better used and needed by people on the front lines. While this is legitimate, could this be viewed as punching down instead of punching up? Is it wrong for people to use masks when healthcare facilities have PPE shortages? How could we redirect this conversation? So if the people already have the masks, the hospital doesn't have those masks. People should use the masks that they have. As far as the larger supply chains for masks and things, that's not a decision that's up to individuals. And if individuals have masks, they should absolutely use them. Widespread population-wide use of masks is a big factor in preventing spread. I absolutely think that this is a punching down rather than punching up. It's the responsibility of the public health systems, the government, and the hospitals to secure and provide masks and other protective equipment for their facilities. Yeah, so someone's commenting that masks online are sold out. There's no money to buy masks, and this is the responsibility for this again lies with our capitalist class and capitalist government and the way that healthcare is structured. But bandanas and other cloth coverings over the face are better than nothing. The evidence, the current evidence, is that the main way that that COVID is transmitted is via droplet. So this is droplets in healthcare science are small droplets of moisture, spit, other fluids that are thrown into the air. Droplets are relatively, they're very small and they look like a mist or even invisible, but they're much heavier than just single airborne particles. There's not much evidence that the COVID is spread as an airborne virus. So this is a more contagious form. So diseases like tuberculosis, measles are airborne. So that the virus itself, virus particles, can survive in the air apart from fluids, and they can travel, yards, tens of yards, and can remain in the air for long periods of time. There's not a lot of evidence that COVID is transmitted this way, unless it's aerosolized. So this is pretty rare. That's not to say that it's impossible, but the evidence shows that the main way that it's spread is through droplets, and face coverings with normal cloth are definitely going to reduce that. It's not the ideal protection, but it is definitely better than nothing. So we've got a couple questions. So my union is not fighting for hazard pay for workers forced to work, let alone no use of comp time unless we've banked 2 weeks plus, so we'll have to go without pay. Has there been a vocal call for hazard pay and PTO for all workers? Is that something that's been awarded in other countries? So yes, other countries, lots of countries in Europe, China, and other places have given hazard pay and also paid time off. I believe England is paying 80% of people's salaries that are unable to work. So I think this is definitely a demand that we can raise, in similar to struggles that are going on not during this kind of pandemic crisis, the best way is to connect with the rank and file of the other people in your union. Point out that this is being done by other countries, that other workers in the United States have won these demands, and that the rank and file can consolidate and put pressure on their union officials that are not taking this action and not taking a militant stand, and build power from the rank and file. So we've got, Steph saying, at my workplace we won $2 per hour hazard pay for essential workers who have the ability to work. So this is, kind of another example, like, if your union's not fighting, fight to make it fight. The employer's initial plan was just to let us bank negative sick time, but they pushed back against this. Okay. So we've got a question from Bassam. Can you talk a little bit about the stimulus package and the capitalist contradictions to profits over people? So the strongest response that we've seen from the federal government has been trillions in dollars of aid to the big banks, and even and more money to major corporations. I haven't looked at the details of the stimulus package that was passed. I think it was around $2 trillion of money, not loans like the previous actions from the Federal Reserve, but money payments, and it's a tiny fraction of that is going to working class people. The figure that we've seen is $1,200, not even getting that to everybody in the U.S., just people who have filed taxes. Even immigrants with a federal tax ID are not going to get that payment, even though they're paying taxes. Unemployed people. They like the whole, from what I understand, the whole process of the legislative discussion over this stimulus package was a constant wrangling to give less unemployment benefits, to give less direct payments to working class people. I think the way, from what I read, the way it breaks down is that about $1,600 per capita are going to corporations, and about $1,200 per capita going to working class. So this is exactly what we would expect from a system that is prioritizing continuing, maintaining the profitability of their system over supporting working class people. So we've got a question. My mother is a social worker for Kindred Healthcare, and they're not taking preventative measures to prevent the spread to caregivers, patients, and their families. Her coworkers are not unionized and have been emailing higher-ups who have the control to play policy, but this is urgent. What other tactics could be helpful for them to demand proper PPE and preventative practice? So I don't have a lot of experience as a labor organizer. I've come from North Carolina, where union density is really low, and I don't currently work in a unionized position now. But the fundamental kind of basics of rank and file militant organizing is connecting with as many of your coworkers as possible, as many of the rank and file, and getting everyone together rather than emailing individually. Signing as many people on as you can to a demand. The fundamental power that we have as workers is the ability to withhold our labor. This is a time when, especially healthcare workers, our labor is needed more than ever. And so the threat of a strike or withholding our labor is more likely to be taken more seriously. And also the consciousness of the workers is definitely impacted by the pandemic. People are feeling an urgent, desperate need right now to have the proper PPE, and I think this provides good conditions to get more of your coworkers on board with making a unified demand on the employer. Okay. To echo Julia, so this is a comment from Steph. To echo Julia, I've also heard from a friend who does home care that they're struggling to get PPE. In many urban areas, home care workers are the lower section of the working class and oppressed nationality. This is absolutely true. And again, connecting with other workers, your peers, as much as possible to make a unified demand on the employer. What can home care workers do from the perspective of personal protection if they don't have proper and specific equipment? I'm not sure if I can, make really good recommendations. I think the best, you can do things like, homemade masks. I think it's really sad and indicative of the failure of our system that's even something that people are considering, but that is better than nothing. Calling home care workers should demand that testing be made available for their clients. If the clients are sick, getting them the care that they need. But also the basic measures of, rigorous quality hand washing, washing hands, home care workers washing hands with soap and water for 20 seconds before and after entering a patient's home can benefit both the patient and the worker. And that's something that can be done, even if the employer is not providing adequate equipment. So maybe this is something, this is a question from Ryan, maybe this is something that the other FRSO statement video covered, but what can people do to organize during the time of social distancing? The car protest was unique, but what are other things people can be doing to continue to build our movements and advance our demands? So, I think we're all familiar, a lot of organizing meetings have moved online to Zoom calls. Something that on the National FRSO People's Response to COVID video covered, one kind of creative thing that Sol mentioned that they're going to be doing is individually, like they're, even under the social distancing recommendations, they're allowed to, go for a jog or run individually. And what they're planning on doing is on their, government-approved once daily jog, taking with them a poster to, put up demands. I think they were organizing around May Day, but individually going and putting up posters or placards rather than as a group. So, still doing it safely, doing it in a way that doesn't break social distancing, but still adapting to the conditions and still being able to reach people that way. With elections, so we have a question from Bassam. With elections coming up and knowing the flaws of the systems, many states have primaries coming up that are not canceled. What's the political and safety recommendations? I don't know, maybe someone else can comment about this and with their thoughts. I mean, having polling places, I don't know about most places, but a lot of the volunteer workers at the polling places in Chicago were older folks, and having mass numbers of people come in, even one at a time, having direct contact with them does put them at risk, and it puts the people standing in lines at polls at risk. So just from a health perspective, they should be canceled or postponed during this time. From a political perspective, I'm not as sure, but the Democratic Party choosing not to postpone primaries, during this pandemic is really, has just flagrant disregard for people's health and safety. So we have another comment from Julia, and so my mom works 2 jobs. One is a social worker, another is a home care nurse. Both jobs are putting her patients, and her family in danger. She sees patients every day, sometimes multiple times a day, and was only given 1 mask. This is, unfortunately, a pretty common, situation. At my workplace, we're now, we were able to secure some additional masks. They're still being rationed, but the first 2 weeks of the social distancing measures, we got 1 mask, and I used that mask for like a week and a half. So regarding the political stuff, and so we have a comment saying, this is why we need to march, the coalition to march on the DNC. This is something I haven't mentioned yet. That we are part of the, we're part of a coalition to march on the DNC and put a list of people's demands, presenting it at a time when all the eyes of the country and the world are going to be on the Democratic National Convention in Milwaukee. I think this is a really important next step politically, particularly seeing how resistant the Democratic Party is to real change. And so I think we need to be going forward with organizing with that. It remains to be seen whether the Democratic National Convention is going to still be held in the form that it was planned. So that's a little up in the air, but we're continuing to organize, and I definitely recommend that as a organizing project going forward. I think that this crisis has just brought in sharp relief a lot of the contradictions that we're fighting every day around, particularly for the demand for Medicaid for all, Medicare for all, and at a time when people need healthcare coverage more than ever. 3 million people just lost it because they lost their jobs. This is, it's a no-brainer why we need Medicare for all. So Steph says, I want to raise a contradiction. Given the nature of the system, we don't want to allow the suppression of democratic rights in general, despite the need for social distance. Can you speak to this contradictory situation? So absolutely, this is a contradiction, and that's why I just spoke to the public health aspect of canceling or delaying primaries. I'm not sure. maybe maybe someone else, or maybe Steph could write a comment. I think we do need to be demanding our democratic rights. I think we need to continue vigorously organizing and staying connected as online as much as possible. Erica's suggesting demanding that primaries be mail-in. I think that's a good idea. We can still make our voice heard even if we're not at a place in person. Another question here from Ryan. Do you expect to see any uptick in police brutality, particularly in oppressed nationality communities that may be harder hit by the virus because of a number of factors as the crisis deepens and maybe local governments begin to clamp down on shelter-in-place orders? Yeah, absolutely. I think that the response to this, controlling people. So there's there a lot of the Western media has highlighted the population control aspects of the pandemic response in China. A lot of tracking of individuals through phone apps, being able to track people, who are, identified as positive for the virus, but using this in a, extremely humanitarian way by allowing people to know if they are exposed. So I think, things like quarantine and shelter in place and, tracking of people that are infected, these kinds of measures, just like, violence itself is not an inherently positive or negative thing, but depends on the class orientation. And I think absolutely in this society that has a capitalist oriented toward the capitalist class, the state stepping in to control the population is going to be skewed towards oppressing people and increasing violence. So Steph has a response around the contradiction between democratic rights and things. I think we do need to demand our democratic rights. We need to oppose things like militarized quarantine and police violence while organizing people to practice solidarity by voluntarily social distancing. So I think that's a good orientation. I think we'll wrap up this broadcast here in just a moment. I would like to plug the National Freedom Road page. So this discussion was kind of informed by our Study Sunday program, and there's a current post there that summarizes the differences between the capitalist and socialist responses in a little graphic that's easily shareable, and also has links to the articles that I drew things from. So primarily from several articles from Fight Back, but also some others, from MSN had a story about the Cuban medication that's being produced against COVID. Code Pink had a very good article about the Venezuelan response to COVID, and there's a lot of others. So I'd like to plug those links. Go to the Freedom Road National Facebook page and Instagram and Twitter, and you can find those links. Join Freedom Road Socialist Organization so that we can have a society where this kind of situation doesn't result in mass death, and instead we have an organized response. And we have been discussing doing more programs like this. Increasing political study and discussion. Potentially on a nationwide basis. So I think that is something that we can be on the lookout for. So I'd like to thank everybody for tuning in. And solidarity against the virus.